Hi friends, Namaskar and a very warm welcome to this image-based discussion video session or pixelosis. See, the images in community medicine, they are not like medicine or surgery, anatomy or pathology where you have to identify what is the structure or what is the cell type or whether there is fluid in the pleural cavity, yes or no, and things like this. Images in community medicine, they are super duper easy. I have divided the images into 5 classes. The first class belongs to the old gold answer types, the public health images, the logos, the national health programs, and so on. Very commonly asked 5-star topic. Next is, yes, very frequently people will ask you entomology, anopheles, culex, hardtech, mite, and things like this. Then there is talk of the town these days. A lot of questions have started coming on environment. Environment has taken a center stage, 5-star MCQ. Then is graphs, graphical presentation, again old gold topic, very commonly frequently asked, what is correlation graph, regressions and scatter plots and things like this. And last is again old gold topic, that is mother child health scheme, GSSK logo, Anemia Bharat logo and things like these. Let us take on the first topic, that is the national health programs, the public health logos and images. If you look at this first very frequently asked logo, what is this logo? See, question, I told you that images in community medicine, they are super duper easy. Either you know them or you don't know them. You can't scratch your head and say that this looks like a national lotus program. There is nothing called as lotus program. This you have to remember, lotus leprosy. So just remember, what is this logo for? This is a National Leprosy Eradication Program, NLEP. What does NLEP stand for? National Leprosy Eradication Program. In this logo, you have to know 3 things, beta. There are 3 parts of this logo. The first part is the lotus flower. So what does this lotus flower denote? It denotes purity, it denotes an important element of the society, that is the leprosy patient. Leprosy patient is the lotus, and then you have inside this rising sun, the rising sun. Rising sun is the multi-drug therapy, MDT, and this hand is the hand of NLEP, Government of India. Next, what is this logo? This logo you can see over here, this circle, this earth kind of thing, and then there are 3 people into it. Remember, 3 people into it, these are our 3 friends, and this logo is for the program called as IDSP. What is IDSP? Integrated Disease Surveillance Program. This Integrated Disease Surveillance Program, you remember there was the earth and there are 3 friends. Who are the 3 friends? You have to remember 3 friends, S, P and L. What is S? S stands for syndromic surveillance. Syndromic surveillance. P is for the probable surveillance. Probable surveillance, and last L stands for the laboratory surveillance. Laboratory surveillance. So it's an integrated disease surveillance program. Syndromic surveillance is done by the health workers, and the probable surveillance is done by the doctors, medical officers, and laboratory is of course done by the laboratory. This is IDSP. What does this logo stand for? This logo, you can see something which is rising and something which is stopping, which is coming to an end. So rising is standing for the births and coming to an end is the deaths. This logo stands for CRS. What is CRS, beta? It is Civil Registration System. CRS stands for Civil Registration System. It will take into account what? It will take into account 2 things, the births and the deaths. Births and deaths, they both should be registered within 21 days if you recall. You should also know SRS. SRS is separate thing. SRS stands for Sample Registration System. It is a dual registration system. Dual registration system, SRS. But the symbol over here, this symbol stands for CRS, Civil Registration System. Next is, what is this logo? This logo, you can see over here a Q. And this Q has a tick inside. So Q stands for the quality. Q stands for the quality. Quality stands for the National Quality Assurance Program. So please note that this symbol, Q symbol, it stands for the National Quality Assurance Program. And in National Quality Assurance Program, if you recall, under the National Quality Assurance Program, we already have discussed many things. What is Sakushal? Sakushal. We also discussed what is Lakshya. We also discussed what is Muskan. If you recall, a quick recap, Lakshya is for labor room quality assurance. Sakushal is for self-assessment quality assurance by the hospitals. It is a self-assessment feedback tool of how the hospitals are doing about the patient care. And Muskan is for child-friendly hospital services by the different hospitals. So Muskan, Sakushal, Lakshya program, all these are under the National Quality Assurance Program. Then you see 3 people and with the flowers in their hand. This stands for the National Program for Non-Communicable Diseases. It is the NPNCD program, National Program for Non-Communicable Diseases, and the name has been changed. Earlier it was called as National Program for Cancer, Diabetes, Cardiovascular Disease and Stroke, but now it is now called as, it is now renamed to National Program for Non-Communicable Diseases, which take into account chronic kidney disease, rheumatic fever, asthma, respiratory disorders, liver disease and non-alcoholic fatty liver disease, alongside cancer, diabetes, cardiovascular diseases and stroke. Let us go to the next symbol. What does this image stand for? You see the I over here. This I stands for the NPCBVI. What is NPCBVI? NPCBVI stands for the National Program, long name, National Program for Control of Blindness and Visual Impairment. When do you say blind? Blindness is less than 3/60. Less than 3/60 in the better eye with best possible correction. What is visual impairment? If the visual acuity is less than 6/18 in the better eye with the best possible correction, NPCB. Why is there a red cross behind it? It's actually not a red cross. It is but the symbol from DANIDA. DANIDA stands for Danish International Development Agency, which is the main funding agency. It is the main funding agency for the NPCBVI, National Program for Control of Blindness and Visual Impairment. On the right hand side, what is this image that you see? This image that we see, you see a Deepavali Diya. Remember Deepavali Diya. I have remembered, whenever I will see Deepavali Diya, I will remember labor class people. Labor class people, Ministry of Labor. Ministry of Labor is ESI. ESI is Employee State Insurance Scheme. ESI. Employee State Insurance Scheme. Employee State Insurance Scheme, please remember it is under Ministry of Labor. It is under Ministry of Labor. How much do they contribute? The employee will contribute 0.75 and employer will contribute how much? 3.25% of the wage, and they will come together and give it to the ESI corporation. In case of physical handicap, the ESI is going to take care of all the contribution which the employer has to make for 3 years. 3-year contribution. 3-year contribution by ESI from the employer side, right? For physical handicap people. Alongside, for what is the salary, like how much, who will get the benefit? The beneficiary. The beneficiary is all people, all workers with salary less than 21,000, and in case of physical handicap, now the salary is less than 25,000. So make sure that you remember these numbers, and it is a very frequently asked program, ESI. Make sure you remember this ESI, study it from the main videos or the revision videos, and make sure you study ESI and go. ESI has been asked multiple times in your exam. So this is ESI. Remember this logo. This logo stands for ESI. Next in line, what is this logo, beta? You can see over here that a family, happy family is there. You can see the family over here. And this family is having a protection from this fellow. Who is this fellow? This fellow is the mosquito. So what is this program? National Vector-Borne Disease Control Program. What is NVBDCP? NVBDCP stands for National Vector-Borne Disease Control Program. NVBDCP. So please make sure that under NVBDCP, how many diseases are there? There are total 6 diseases: malaria, dengue, Kala Azar, lymphatic filariasis, Japanese encephalitis, and one more, chikungunya. For chikungunya, very recently we have a new vaccine. What is the name of the vaccine? Ixchiq vaccine. It's a new vaccine. It's a new vaccine which is now available for chikungunya. For Japanese encephalitis, what is the vaccine? How do we prevent Japanese encephalitis? It is the vaccine which is a killed vaccine, and this is a Kolar strain killed vaccine. For lymphatic filariasis, how do we prevent lymphatic filariasis? It is by giving mass drug administration. When do we give mass drug administration? It is given biannually. It is given biannually. How many drugs do we use? We use 3 drugs. Which 3 drugs? IDA. What is IDA? Ivermectin, ivermectin, we also use DEC, and we also use albendazole. For dengue, there is no prevention. We just have to prevent the household collection of water. It is only based on mosquito control. It is primarily based on mosquito control. For malaria, what is the prophylaxis? What is the drug of choice for prophylaxis of malaria? It is, of course, we do mosquito control alongside. What is the drug of choice? If you recall, we have doxycycline in case of short-term travel, and we also have a mefloquine in case of long-term travel. In case of travel long-term, it is mefloquine, otherwise it is doxycycline. Next in line, what is this logo? This logo stands for the child is integrated inside the mother. So it is Integrated Child Development Services, ICDS. Remember, what is ICDS, beta? ICDS stands for Integrated Child Development Services. It was started in 1975, very old program. It is under Ministry of Women and Child Development. It is under Ministry of Women and Child Development. Under ICDS program, we have Anganwadis. Right? So that is about the ICDS program. Next in line, what do you see these logos? This logo, you see over here a curved kind of thing. Remember, this is for Poshan Abhiyan. It is for a Poshan Abhiyan. What is Poshan Abhiyan? You have to be ensuring yourself that you know there are two portions that you have to study. You have to know now there are two problems. One is Poshan Abhiyan, another is a Poshan scheme. What is Poshan Abhiyan? Poshan Abhiyan stands for Prime Minister, Pradhan Mantri, overarching scheme for holistic nourishment. So it is Pradhan Mantri, Prime Minister, overarching scheme for holistic nourishment. Beta, this is under Ministry of Women and Child Development and Ministry of Health and Family Welfare. If you get single best answer, please mark WCD Ministry. So this is the National Nutrition Mission. Under this Poshan Abhiyan, it's a big umbrella program. Under this umbrella program, we have lot of smaller programs. We have school nutrition programs, we have Balwadi programs, we have Anganwadi programs, we have Anemia Mukt Bharat under it. We have lot of nutritional programs. Government of India, they launched under them, the Ministry of Education, they launched another scheme recently in 2021 called as Poshan Scheme. In Poshan Scheme 2021, they launched Poshan Scheme. What is the full form of Poshan? It is Poshan Shakti Nirman Scheme. So under the Poshan Shakti Nirman Scheme, this is the new name for the old program, that is the midday meal program or the midday meal scheme. So midday meal program and midday meal scheme is now stopped. These are the old names and they have been changed over to Poshan Shakti Nirman Scheme. It is under Ministry of Education. These both are 3-star MCQ. They can come in your exam because Poshan Abhiyan was started in 2018 by the Ministry of Women and Child Development, and Poshan Shakti Nirman Scheme, say with me, Poshan Shakti Nirman Scheme was started in 2021 by Ministry of Education. This curved symbol, remember, it is for Poshan, Prime Minister overarching scheme for holistic nourishment, Poshan Abhiyan. This is Poshan Abhiyan. Next in line, what is this logo? This logo, you can see over here 5 petals. Of course, this looks like the BJP logo, but it is a 5 petal. What are the 5 petals? 1, 2, 3, 4 and 5. This is the ambitious Ayushman Bharat program. Ayushman Bharat program. Why do they have 5 petals? Because it is for Ayushman Bharat it is giving 5 lakh rupee cover, 5 lakh rupees cover, health insurance given to 50 crore population, which is equal to 10 crore families. So 10 crore families will be getting 5 lakh rupee health insurance cover, that is amounting to 50 crore population. This is the world's largest health insurance scheme. It is Ayushman Bharat scheme. So under Ayushman Bharat, they launched this Prime Minister Jan Arogya Yojana. This is the technical name for the health insurance scheme. It is the Ayushman Bharat scheme. Under Ayushman Bharat, beta, you should also know there are some new things which have started. We have already discussed in the main lectures, in the revision videos as well, that what is ABHA ID. ABHA ID is Ayushman Bharat Health ID. Ayushman Bharat Health ID is called as ABHA ID. And we also have launched a new portal called as E-Sanjeevani. E-Sanjeevani is for telemedicine services under the very bigger program, umbrella program, Ayushman Bharat. Under Ayushman Bharat, we also have started calling the sub-centers as health and wellness centers. Health and wellness centers. Why do we call them as health and wellness centers? If there is a post of CHO which is available. So make sure you study the chapter, you study the topic on healthcare system in India, where I have discussed much in detail about Ayushman Bharat. So a lot of points may come to you on Ayushman Bharat. That Ayushman Bharat may includes the Jan Arogya Yojana scheme. It also includes this comprehensive primary healthcare system like the health and wellness centers, the CHOs. What is CHO, beta? Community Health Officer. Community Health Officer. So community health officers, they are now part of the health and wellness centers under the Ayushman Bharat scheme. So what is this logo? This logo is for Ayushman Bharat or the PMJ. PMJ. What is PMJ? Prime Minister Jan Arogya Yojana. They both are synonymously used. Beta, PMJ is a part of the Ayushman Bharat. Next in line, what is this logo? What does this logo stand for? This logo it's a new logo for the National TB Elimination Program, NTEP. Under NTEP, what we are doing is 99 dots. What is 99 dots? It is mobile technology. It is mobile technology based compliance scheme. Compliance strategy, mobile technology based compliance strategy, where the patient has to give a missed call after taking the tablets of TB, and that is how we are monitoring using information technology, using mobile technology. It is called as 99 dots. Also another update which is there in NTEP, which you should be knowing, that the Government of India very recently in August 2024, they introduced the BPALM regime. What is the BPALM regime? The BPALM regime is now approved by Government of India NTEP. It includes bedaquiline, pretomanid, linezolid and moxiflox. BPALM regime, and it is now approved for the MDR TB cases, longer MDR. So they are giving as a longer MDR TB cases, or they are giving to the XDR TB cases, and this is a new regime which has been approved by Government of India. Coming to this next logo, it's always one of my favorite logo, happy smiling smiley face logo. What is this logo? This logo is for National Iodine Deficiency Disorder Control Program, NIDDCP. So smiley face, remember NIDDCP. What is NIDDCP? National Iodine Deficiency Disorder Control, NIDDCP. National Iodine Deficiency Disorder Control Program. So under this program, what do? We iodize the salt. Iodize the salt. So what do we do? How do we iodize? Do we use potassium iodide or do we use potassium iodate? We use potassium iodate. We iodate the salt. Always remember, potassium iodate is used, and it's not the potassium iodide which is used, it is the potassium iodate. So how much iodine should be there in the salt? At the manufacturer level, it should be more than 30 parts per million. Why do we want it 30 parts per million? Because in your and my home, at the consumer level, we should be taking at least more than 15 parts per million. This is the main process indicators. This is the process indicator of the NIDDCP. So just a word of caution for you guys, that beta, before you go for your exam, make sure that you do the indicators. You do the indicators in NIDDCP. These have been very often asked in your exam. Coming to this next logo, you see over here sunflower. Sunflower always looks towards the sun, always looks towards the positive side of the life. Why do we say positive side of the life? Because depression is known to have the highest DALY. What is DALY? Disability adjusted life years. Depression is known to have the highest DALY, and this is the sunflower. Sunflower is the symbol for National Mental Health Program. Actually, it's not a National Mental Health Program. Sunflower is a symbol for mental health. Sunflower is actually a symbol for the mental health, and this has been adopted by the National Mental Health Program for keeping this as a symbol of mental health. That is the sunflower. Remember, sunflower is a symbol of mental health. Next in line, what is this inverted triangle? Whenever you see a red color inverted triangle, it is for family planning. It is for family planning. So inverted triangle, it is a symbol for family planning. So this symbol over here, this is for the National Family Planning Program, NFPP, National Family Planning Program. And what do you have over here? This is a symbol for NHM. What is NHM, beta? National Health Mission. National Health Mission. What do we see in the National Health Mission? What we see over here is the father, then we have the mother, and then we have one daughter. Why do we have one daughter? Because the National Health Mission wants that the NRR should be equal to 1. Why the NRR should be 1? Because this NRR 1 is called as the replacement level. What is replacement level? That is, the daughter is going to replace the mother. The NRR, net reproduction rate, will be equal to 1. It also means that the total fertility rate, that is the total number of children, should be 2.1. Total fertility rate to be 2.1, NRR to be 1. Next in line, what is this logo or this symbol? It's actually not a logo. This is, you can say, a mascot for one of the program. It is a mascot. This over here you see is parrot. So just remember, this is Meena. Meena, beta, Meena is a small girl child. It's a cartoon character which has been adopted by the United Nations as a mascot for girl empowerment. She's a mascot for girl empowerment, and this has been adopted for leprosy awareness. So please remember, Meena is a mascot by United Nations for girl empowerment used in leprosy. On the same principle, we see another girl over here. This is more Indianized version of the Meena, and this girl, beta, is called as Sapna. Sapna is same answer. She is a mascot for women empowerment, and she works for the leprosy awareness. Remember, Sapna is a school-going girl child. Sapna is a school-going girl child. She has a school bag. Remember, Meena with the parrot, and Sapna is with the school bag. And now coming over to the next one, what does this symbol stand for? This symbol stands for the biohazard, beta. It is the biohazard symbol, and this is for the biomedical waste management. It is for the biomedical waste management symbol. This is the symbol for biohazard. On the same principle, we also have a separate symbol which is for the cytotoxic waste. Cytotoxic waste will always have the symbol with a triangle with the symbol C, and this cytotoxic waste is again a yellow category. Remember, lot of times students have asked this. It's a yellow category waste. So cytotoxic drugs, their consumables, their vials, their IV set, their bottles, everything goes into the cytotoxic category. That is the yellow category. Next is this fan kind of symbol. It is for the radiation waste, radiation hazard. So wherever there is radiation hazard, the symbol has to be there. Next is there's actually not a symbol, but of course you should know what is written here, and of course it's normal English, everybody can read this. What is this? SAANS, SANS. SANS. So SANS it's a project, you can say, which has been started by the Government of India, Ministry of Health and Family Welfare. SANS stands for Social Awareness and Actions to Neutralize Pneumonia Successfully. SANS stands for Social Awareness and Actions to Neutralize Pneumonia Successfully, and it has been started alongside the UNICEF. What happens is, I think everybody of you know about it, that pneumonia is very fatal in children. So I already know, but I don't want to generate a controversy over here. So this is just extra point for you to know that under SANS program, you already know the different categories of pneumonia. There could be no pneumonia, there could be pneumonia, or there could be severe pneumonia, right? In case you have studied pediatrics or you have studied IMNCI protocol, you already know that chest indrawing is taken into pneumonia now. So chest indrawing with or without chest indrawing. So even if the child is with chest indrawing or without chest indrawing, it is under IMNCI, it is taken in pneumonia. But as per the SANS protocol, beta, chest indrawing, if it is present, if the chest indrawing is present in a child, it is taken into severe pneumonia or very severe disease. I do not want, again I am repeating, I don't want to generate a controversy, but if the MCQ says that as per management, as per the SANS protocol, then you have to put chest indrawing into severe pneumonia. But if nothing is mentioned, if nothing is mentioned in your exam, then you have to follow the pediatric guideline, you have to follow the IMNCI guideline, where the chest indrawing is now put under the pneumonia. So in pneumonia, what is the treatment we give? We give oral amoxicillin. Okay. So I hope I'm very clear over here. SANS is only for tribal areas, for far-flung areas, rural areas, where chest indrawing is not considered pneumonia. Chest indrawing is still considered as severe pneumonia, and the CHO, that is the community health officer at the health and wellness center, they will manage the child by giving the first aid and using the e-Sanjeevani portal, using the telemedicine portal. They talk to the medical officer and do the proper appropriate management, but the child is referred as, the child is classified as severe pneumonia. This is one point you should be knowing about SANS protocol. Otherwise, for all general answers, please note IMNCI is better answer, or pediatrics answer is a better answer compared to the SANS protocol. Next in line is the next topic that we have is entomology. Identify the insect over here. These both insects, beta, these both insects are mites. Many times you will get a trouble how to identify this as a mite from this as a tick. So please remember, ticks and mite, they both look almost similar. There is no difference. There is very slight difference. Just have a look at this mite. This mite is globular. It will have 3 to 4 legs. This larva, this is the larval stage. Okay. The adult stage of the mite will have 4 legs. So in this 4 legs, the anterior legs, they are very thick. There are thick anterior legs. Any insect where you see the thick anterior legs, please mark Sarcoptes scabi. This is called as the itch mite. It is called as the itch mite, which is the Sarcoptes scabi, and it has thick anterior legs. It will be globular in structure. On the same principle, you come to the other one. This is a larva of the mite. This is a trombiculid mite. The difference between, I'm telling you very small difference, which I don't know if you will be ever able to appreciate in your exam, yes or no, because it's a computer based system. You can't touch the mite and see, right? So of course nobody is going to ask you to touch the mite, but what you see over here, the mite will always have lot of hair. There is lot of hair on the body, on the legs also. If you see the tick is almost hairless. There is less hair on the body or on the legs. On the mite, if you see, there will be lot of hair, and this is the only difference. Otherwise, they both are spider-like insects. Mite will have, this is the trombiculid mite, it is red in color. This actually, the mite is very small and it is red in color. It has very long legs, and this is again globular. The larva will have 3 legs, but as the larva will become adult, it may develop the 4th leg also. So larval stage will have 3 legs, just remember this. And this is trombiculid mite. It is a trombiculid mite. So I'll write over here, it's a trombiculid mite. It's a trombiculid mite, what you see in this image. And on the other hand, this image is for the itch mite. Now coming to these 2 types of tick. So which one is a hard tick and which one is a soft tick? Whenever you see the head, remember, whenever you see the head in a globular, again same answer, the globular structure, and then there are 4 legs on each side, there are 4 legs. But if you see the head, beta, this head is called as a head tick or a hard tick. So in the hard tick or the head tick, the head is visible. Whereas in a soft tick, beta, the head is of course there, every tick will have the head, but the head is kind of more towards the underside. So it is more towards the underside and it is not visible from the top. So if the no head is visible, it is called as soft tick. If the head is, just to summarize, no head visible, globular with 4 legs, globular with 4 legs, no head visible, soft tick, globular with 4 legs, head visible, hard tick. If it is globular with 3 legs or 4 legs, but there is hair on the head, on the legs, on the body, this is called as a trombiculid mite. and then if the anterior legs are very thick, it is called as itch mite. That's all. Next in line, how to identify these elongated elongated insects, you can say, not people. So whenever you see an insect which is elongated, long, remember long insect, it is called as a louse. It will always have claws on it. So there will be claws on it. It is called as louse. Louse-borne illnesses, there are a lot of louse-borne illnesses. It is retired, you can remember it by retired. Relapsing fever. E stands for epidemic typhus. T stands for trench fever, and D stands for dermatitis. You can remember louse-borne illnesses as retired. Louse is long, long is lazy, lazy is retired. Just remember it somehow. Now you see this insect which is a flat kind of insect. It is left and right bilaterally flattened insect, and this flattened insect will have long legs, and this is called as a rat flea. It is called as the rat flea. It is the school home name is rat flea, nickname is rat flea, the school name is Xenopsiella chiopis. It is called as Xenopsiella chiopis. It is called as Xenopsiella chiopis. So now sometimes examiner may also trouble you beta regarding different types of mosquitoes like Anopheles, Aedes, Culex. The trick to solve these MCQs is that never look at the head. If you look at the head, then your answer is wrong. So head is always down in a mosquito because that's the only way it will bite now. So head is always down facing. Now the trick over here is beta, you have to always see the tail. If the tail is up, okay, if the tail is facing upwards towards the sky, remember tail facing up, anus up, remember it is Anopheles. Remember it is Anopheles. And if the tail is parallel to ground, if the tail is parallel to ground, remember this is Aedes mosquito. And remember that if the tail is going down, if the tail is also going towards down, if the tail is down, it is what we call as the hunchback mosquito. It is what we call as the little brown nuisance mosquito, hunchback mosquito called as the Culex mosquito. So repeat with me, tail is up, Anopheles, tail is parallel, Aedes, tail is down, hunchback, Culex mosquito. Sometimes examiner may still be very cruel and still they will be asking you regarding the different types of eggs. You have to memorize what are the different types of eggs which are there. So Anopheles mosquito, as you can see over here, the tail is up. In the Anopheles mosquito, remember that the eggs that we see, these all eggs, these are single eggs and they are boat-shaped eggs. On the other hand, if you look at the Aedes mosquito, the Aedes mosquito are also the single eggs and these are cigar-shaped elongated eggs. These are cigar-shaped eggs. And on the other hand, if you look at the nuisance mosquito, the brown, little brown mosquito, which is the Culex mosquito, the Culex, C for Culex, remember C for cluster. And the Culex eggs, they are always in clusters, they are in sheets or they are in raft. We call them as eggs are in collected, they are clustered in rafts or in sheets. And on the same principle, if you look at the Mansonia mosquito, the Mansonia mosquito also has the eggs which are there in clusters. And this cluster is like a cluster. It's actually a cluster and it is star-shaped clusters, or we also called as a flower arrangement or a floret arrangement or a flower arrangement. So repeat with me, Anopheles is single egg boat shaped with lateral floats. Aedes, it is single egg cigar shaped. Culex, it is clusters, and Mansonia is in star shaped clusters. So now coming over to the next chapter beta, that is environment, which is a 5-star MCQ. Recently, a lot of questions have started coming on environment, and of course, we are going to talk about nutrition as well. First image in environment nutrition chapter, what do you see here? You can obviously see, you can appreciate 6 cups which are there, and then you can see some of the bottles and the reagents. What is this apparatus called as? It is called as Horrocks apparatus. What is the use of Horrocks apparatus? Horrocks apparatus will tell you about the chlorine demand. Chlorine demand of water, it is the amount of bleaching powder which is required. So this is what is Horrocks apparatus. Next in line, what do you see here? This is actually a chloroscope. What is the reagent which is used in a chloroscope? The reagent that we use is called as orthotolidine. We can also use orthotolidine arsenate as a reagent, And this arsenate and orthotolidine test, they both are going to tell us about the free chlorine levels. And this is what we see as chloroscope. You just add the reagent and then you see the color change, and whatever level of the color is there, it is going to tell you. This is what we call as chloroscope. A few points which are very important for you to revise before your exam about chlorination. What is the use of chlorine demand? Chlorine demand is given by what apparatus? It is given by Horrocks apparatus. And what is the Horrocks apparatus going to tell us? It is the amount of bleaching powder which is required for 455 liters of water. So to disinfect the 455 liters of water, how much bleaching powder is required? This is given by Horrocks apparatus. And what is the mechanism? The mechanism of chlorination, it is by formation of free radicals. Which one is the main free radical? It is hypochlorous ions. What is the other free radical? It is hypochlorite ions. They both are called as free radicals. So formations of free radical, that is hypochlorous and hypochlorite, that is the mechanism. How much should be the chlorine level in water? In drinking water, beta, it should be more than 0.5 parts per million. In impending outbreak, it should be more than 0.7 parts per million, and in swimming pools it should always be more than 1 part per million. Who has the job of doing chlorine demand? Horrocks apparatus. Who has the job of using orthotolidine arsenate? Use the chloroscope. This water quality job function is by the MPW. Which one, male or a female? It is the MPW male who is supposed to take care of the water quality. Next in line, environment. What is this instrument used for? So what is this instrument? What do you see here, beta? This instrument is called as a globe thermometer. This instrument is called as a globe thermometer. Now, many of the students might be thinking that sir has not given the correct options because the answer is not there in the options. So the options are effective air temperature, corrected effective temperature, cooling power of air, and air humidity. So which one do you think is the correct answer? Beta, if you recall, if you have listened to the main videos or the revision videos, if you recall, what is effective air temperature, beta? What is effective air temperature? Effective air temperature includes air temperature. If you recall, it also includes air humidity. And if you recall, it also includes air movement. And if you recall, it also includes cooling power of air. And what is corrected effective temperature? Corrected effective temperature includes effective temperature, that is air temperature, air humidity, cooling power, air movement, plus the radiant heat. And which is the instrument which is used to check the radiant heat? It is this instrument, that is the globe thermometer, beta. Cooling power of air, what instrument is used to check the cooling power of air? It is Carta thermometer. Carta thermometer is used to check the cooling power of air. And air humidity, who will give us the air humidity? Air humidity is checked using the psychrometer or the hygrometer. So air humidity is hygrometer or psychrometer. Cooling power is Carta thermometer. Corrected effective temperature includes air temperature plus humidity plus air movement, cooling power plus a radiant heat. And effective temperature is all except the radiant heat. So now do you understand how this question was asked? This question is asking what is the use of this globe thermometer. Globe thermometer is used to check the radiant heat. It is to check the radiant heat. And radiant heat is one of the components in the corrected effective temperature. So this instrument is used to find what? It is used to find the corrected effective temperature. Of course, not only this instrument, but this instrument is actually used in corrected effective temperature only, right? So radiant heat is given by globe thermometer. Now, before we move ahead, I would like to obviously discuss a few points about Carta thermometer. It has been asked in last 2-3 years. Every exam has asked a question on Carta thermometer. What do you see, beta? Over here is a Carta thermometer. Carta thermometer, it's a very special thermometer. This is what you see is a Carta thermometer. This Carta thermometer, it does not contain mercury. It contains alcohol. It is alcohol based thermometer, and the bulb of the thermometer, it is almost always red color. It is almost always red color, and there is this stem and it contains alcohol. It has been painted as red. Why do we paint it as red only? Because there are different types of kata thermometer. The first type of kata thermometer is a standard kata thermometer, which will be asked in your exam. You might have seen in your museums, it will always be red color kata thermometer. In cases of high temperature, we use blue, and in case of very high, extra high temperature, we use a dark red or a magenta or a purplish color kata thermometer. But generally in your exams and what we have in museums all the time, it is a red color, and that's the reason I was saying always remember red bulb is a kata thermometer. Now I don't know if you can appreciate, if you can see it on your mobile device or not. Can you see there is a small line over here? There are actually two lines over here. So if this is the bulb of the kata thermometer, this bulb is quite long, it's a very elongated bulb. And then there are two lines on this kata thermometer. The first line, that is the maximum line, it corresponds to 100 degrees Celsius, and the lower line, it corresponds to 90 to 95 degrees Celsius. Different types of katas are there. So how much is the amount? Try to understand how much is the fall in temperature. It's not about the rise in temperature, it's the fall. So you take the kata thermometer, you dip it in hot water or hot liquid so that the temperature increases to 100. So once it increases 100, and then you see how fast it falls. How fast? You see, you calculate the time. This time is called as cooling power of air. It also tells you about low air velocity. So a lot of MCQs come on kata thermometer. Beta, what are the uses of kata thermometer? The uses of kata thermometer, it gives us low air velocity, it gives us the cooling power of air. How do you measure the cooling power? Beta, cooling power is given by the formula kata factor divided by the cooling time. So kata factor, it is a fixed factor. It is fixed that how many millicalories per square centimeter it is used. This is what is kata factor. So the cooling power is read as millicalories per square centimeter per second. Why per second? Because cooling time is per second. So this is how we measure the cooling power. It is millicalories per square centimeter per second. This is how we calculate the cooling power. The kata factor is almost always fixed. It is almost always around 470 to 490. Roughly we take it as 480. This is the kata factor that it's already printed on the kata thermometer. So kata factor is fixed for every kata. It is alcohol based kata thermometer. It is to calculate the heat loss or the cooling power of air, and it is used usually in mines, in mining areas where they want to find out the heat stress. And this is what is the maximum people will think and ask you about the kata thermometers. Coming next, what do you see over here? Which flower is this? This is not a Valentine flower, it is argemone flower. What is this flower? It is argemone flower, Argemone mexicana. Why do you study Argemone mexicana? Argemone mexicana, it's a weed which grows in the mustard area, in the mustard fields. This Argemone mexicana, it has a toxin or a poison, and that is called as sanguinarine. Sanguinarine. And this sanguinarine is a very problematic thing. So what is the use of Argemone mexicana, or why do we have this Argemone mexicana? Argemone mexicana contains a toxin. What is the name of toxin? It is sanguinarine. Sanguinarine. What is the disease which is caused by sanguinarine? It causes a disease, epidemic dropsy. What happens in epidemic dropsy? Beta, sanguinarine, it is inhibitor of the glucose or the glycogen metabolism. Because it inhibits the glucose metabolism, there is accumulation of the pyruvic acid accumulation. And because there is pyruvic acid accumulation, now because of this, there is water accumulation in the body. There is diarrhea, there is pedal edema, there is congestive cardiac failure, there is glaucoma, there is ascites, pleural effusions, and all these things. And this is what is the disease. It is called epidemic dropsy. How do we prevent epidemic dropsy? What is the prevention? You have to do de-weeding, remove the Argemone mexicana from the mustard field, or we can also check for adulteration. Check for adulteration. So in the field area, beta, how do we check that whether there is a sanguinarine or Argemone in the mustard field? We can do a nitric acid test. Nitric acid test, or which is done in the field area. It's a very crude test. Or we can also use a chromatography test, which is of course more sensitive. It is more laboratory based test. We can use a chromatography test to test for Argemone mexicana or sanguinarine adulteration in the mustard oil. Coming over to the next chapter, beta, lot of questions come from this as well, specifically in your NEET exam or in FMG exam. what are graphs and graphical presentations or medical research. So first MCQ very frequently asked, what do you see over here? What do we see over here? This, what we see is overlapping circles, and overlapping circles is for qualitative data, and it is qualitative data, and it is called as a Venn diagram. What do you call this as? A Venn diagram. So it tells us about overlapping qualities, Venn diagram. Next in line, what do you see over here? In this, what I see is a step ladder kind of fashion. So what is this step ladder kind of thing? Step ladder kind of thing. Whenever you see step ladder, always remember this is a Kaplan-Meier survival curves. These are survival curves. These are also called as Kaplan-Meier curves. What happens in Kaplan-Meier curves on one axis, on the horizontal axis, on this axis, horizontal axis or the x-axis, we have time on account. And on the vertical axis or the y-axis, we usually take into account the survival or the prognosis. So as any disease will happen, beta, as the disease will progress, common sense, there is obviously more chance that the prognosis, let us say this is the chance of survival, the survival has to decrease, right? It has to come down, and with time it will come down, with time it will come down, and it will come down something like this. So whenever you see something like this, these type of step ladder fashion, it is called as a Kaplan-Meier curve. Kaplan-Meier curve will tell you what? It will tell you the survival analysis. What do you see here? This looks like a scatter plot. It's actually not a scatter plot. It is called as a funnel plot. Why do we call it as a funnel plot? What is the use? The specific answer is there. It is seen in publication bias. It is seen in publication bias. So many articles are there, many journals are there which are going to publish the researches. Whenever you see the researches in different articles, the research should be present in equal amounts on the left side and the right side. It should be equal. It should not be that more articles are presented only on one side, more articles are here and there is no article on the other side. That means there is a bias, there is a publication bias that the journal is favoring a specific type of articles. This phenomena is what we call as a funnel plot. It is used where? It is used in publication bias. What do you see over here? This is beta called as a forest plot. What do we call this as? Forest plot. Where do we use forest plot? Forest plot is used in evidence-based medicine. Which type of study will use forest plot? We make it in meta-analysis. Meta-analysis. So what do you understand by this? How do you interpret a forest plot? You can see that in meta-analysis, beta, different types of study designs are taken. In meta-analysis, you have to watch the main lectures if you don't know what is evidence-based medicine or meta-analysis. But if you would have watched them, then of course, the understanding is pretty simple that in meta-analysis or evidence-based medicine, we take different type of study designs. Now, this first study, the Smith et al. Study, gives you this effect from here to here. Jones will give you this effect, and this is the central effect of all the studies, right? Different studies will give you different effects, and this is the summary measure. The summary measure is always given by a diamond. The diamond will always denote the final effect. So this is what is called as forest plot, which will tell you what? Forest plot will tell you what? Forest plot will tell us the final effect. Forest plot will give us the final effect. Final effect by an intervention or a drug for a particular disease. It is going to give you the final effect. That is what we call as forest plot. Where do we plot a forest plot? In meta-analysis. In meta-analysis, we plot a forest plot, and it gives you the median effect is always with the diamond or the rhombus shape. It is used in evidence-based medicine. Next in line, what do you see here? You can see, of course, the forest plot which I was talking to you right now. You can see forest plot within a circle. It is called as Cochrane. Cochrane is online repository. It is an online database for all systematic reviews and meta-analysis and evidence-based medicine. It's an online database for all the researchers. Next in line, what do you see here? This is a typical example of a scatter plot. This is a typical example of a scatter plot. In scatter plot, what do you find out? We find out correlation. Correlation. How do you find out the correlation? It is given by a Pearson correlation. Pearson correlation. It is given by the symbol R beta. So if the Pearson correlation is upward looking, it is called as R is equal to +1. +1 means a perfect positive correlation, perfect positive correlation. And if the R is coming down, it is called as a perfect negative correlation. It is called as a perfect negative correlation. But please remember that the value of R, what is R? We just now did. It is a Pearson's correlation. It is called as the Pearson correlation. The R could be ranging from -1 to +1. If it is +1, it is called as perfect positive correlation, and if it is -1, it is called as perfect negative correlation. So what you see over here, you can see that the R, the value, the vector is going towards upside. So what is this? The R is +1, that is a perfect positive correlation. That means if this value on the x-axis, if it increases, the y-axis also increases. And over here you can see that the dots are here and there everywhere. So R is equal to 0, it means no correlation. It means no correlation. Over here you see some correlation, but then the correlation is gone. It is called as a curvy linear correlation or a non-linear correlation. Non-linear correlation or curvy linear correlation. So for your exams, most of the times they'll give you the value of R and they will say identify the following scatter plot. So if the R value, for example, let me just throw a MCQ to you. If the R value examiner is saying that the R value is equal to +0.8, identify the correlation. Is it like this? Is it like this? Is it like this? Is it like this? Which one? So A, B, C or D. Common sense 0.8, it is there. So obviously it is looking towards the A type of image. This is what is the correlation coefficients. So you also know that this is what is, what do you think over here? These dots, can you appreciate that the dots are very close to each other? They are on a very close line. So R is -1 over here, minus, it is negative. It is not actually -1, it could be like, -1 would be if it is a perfect 45-degree angle, right? So it doesn't seem to be a 45-degree, but it is a negative correlation. That's what we see. And in this option B, in this image number B, you can see that the dots, they are kind of more haywire, they are more spread out. So because they are more spread out, this shows a weak negative correlation. This shows a weak negative correlation compared to the A, and the A shows a stronger or a strong negative correlation. It's a strong negative correlation compared to the chart number B. I hope you get it, that the dots are more towards the center line. They are more towards the median or the mean, and they are going towards that. So it's an indication of a strong negative correlation because they are more towards it. On the other hand, the dots are more haywire, it shows a weak negative correlation. They both are terms of the negative correlation, right? So next is, sometimes examiner may confuse you with this diagram as well, that what do you see here? Of course, it looks like to be a scatter plot only. But in this, if you see that we can also plot something called as a regression beta, regression. So you have to know what is regression. Regression means to predict. Regression means to predict. If you know the value of one variable, let us say you know the value of 6,000, can you predict that how much will be the value at this particular point? So it will be when you were in 9th or 10th class, do you remember you did something called as linear equations? You remember y is equal to a plus bx, or they used to write y is equal to m plus bx or something like this, right? So this is the linear equation where you can predict the value of one variable when you know the value of another variable. So this is how we do regression. Correlations and regressions, they almost go hand in hand. Using correlations or using scatter plots, we do regression analysis beta. Regression analysis, it can be of two types. We can have a linear regression or a logistic regression. Linear regression is used for quantitative data, and logistic regression, it is used for qualitative data. Logistic regression is used for qualitative data. The regression can further be of two types. We can have a univariate or multivariate. You can see one variable, you can talk about one variable, or you can talk about multiple variables affecting a quantitative or a qualitative data. So technically the regression could be univariate linear regression, or it could be a univariate logistic regression. We can also have a multivariate linear regression or a multivariate logistic regression. I hope you can get this. So we can have univariate single variable linear or single variable qualitative logistic, multiple variable linear or multiple variable logistic. 4 different types of regression analysis can happen using these type of scatter plots or using these type of regression analysis. So of course, a regression analysis, it's more from INI set point of view beta. It is almost never asked in NEET exam and obviously never asked in FMG exam. Regression analysis has been asked in your AIMS exam, in your INI set exam. So it's only important from that point of view. Coming to the next 5-star important topic, what is the mother and child health questions or images that you have to know? So what do you see over here? Which one is the discard point for the vaccine? What do you think is the discard point? When will you discard? When the square is light in color, or when the square is same color, or when the square is dark color? So when will you discard? Beta, the discard point is from the same color. The discard point is when the inner square, discard point is when the same color, the inner square becomes the same color as the circle. So that is the point where you are supposed to discard the vaccine. Identify the site of third dose of FIPV vaccine. If you would have watched the modules on vaccines, you would be answering it. What is the site for third dose of FIPV vaccine? Please note that the first and the second dose of FIPV, it is given where? In the right upper arm, whereas the third dose, it is given in the left upper arm. So what is the site over here? It is the site for left upper arm. It is the site for the third dose of FIPV vaccine, and there you go. This is your favorite immunization child, which many students ask for it all the time. So make sure that you remember everything which is written over here. What is the dose, what is the route, what is the site for all different vaccines, it is given for you guys. Open vial policy is applicable to this product shown below. True or false? What do you think? So what you see over here, this vaccine, it is actually a rotavirus vaccine. And what do you think? Open vial policy is applicable? Yes or no? I see over here what is peculiar is vaccine vial monitor, VVM, vaccine vial monitor. Beta, the vaccine vial monitor, if it is there on the body of the vial, it is an indirect indication that even if you open this vial, you can still close this vial and use this vial. So yes, open vial policy is applicable in this. Yes, it is applicable. So beta, if you see over here, can you appreciate over here the vaccine vial monitor on this product? The vaccine vial monitor on this product is there on the cap. If the vaccine vial monitor is on the cap, it means if you open the cap, you cannot replace the cap now, because the cap, the rubber thing is already gone, the upper thing is already gone. So it indicates that the open vial policy is not applicable. Open vial policy is not applicable. It is not applicable to this product. Whereas if the VVM is on the body, then the open vial policy is applicable on this product. And currently this is the new product for rotavirus. Rotavirus vaccine follows the open vial policy. It is under open vial policy. What is open vial policy? If all the vaccines are opened, it can be used till how much time? It can be used till 28 days beta. It can be used till 28 days if under appropriate required temperature they can be kept. So which vaccines are not under open vial policy? Not under open vial policy. It is only 2 vaccines, that is the BCG and the measles vaccine. BCG and the measles vaccines, they are not under open vial policy. A few questions from this overweight. What are we going to test it for? This is what we do is skin calipers. skin calipers. These are called as Herpenden skin calipers. These are called as Herpenden skin calipers. What will they tell you? They will tell us about the skin fold thickness. They will tell us about the skin fold thickness beta. So we are going to check from 4 sites. Different sites are there. You're going to check from the mid triceps, biceps, the subscapular, the suprailiac, and then you will add them up. If it is more than 40 in case of males, and in case of females, if it is more than 50, it is called as overweight. It is called as overweight. Next in line, what do you see over here? This is your favorite answer. This is the Shakir's tape. Shakir tape. What is the use of Shakir's tape? It is to find out the mid upper arm circumference. Mid upper arm circumference. And I hope everybody knows, if the circumference is less than 11.5, it is called as severe malnutrition. If it is more than 12.5, if it is more than 12.5, it is called as normal. Between 11.5 to 12.5, it is mild to moderate malnutrition. Next in line, what do you see here? What is this intrauterine device type A and type B? The A type, what is this? This is called as a copper 375 device. And the type B, it is a copper T380A device. Copper T380A, what is the lifespan? It is for 10 years. 375 is for 5 years only. Copper 375, it has a blue green color nylon thread, whereas the copper T380A, it has a white color thread which is made up of polyethylene, and it is a white color thread, and the lifespan is for 10 years. Next in line, what is this logo? A logo and a B logo. What is the logo A? You can see a baby napping inside a small circle, semicircle, or that's actually the womb of the mother. So baby is napping, I-NAP. Remember I-NAP. What is I-NAP? India Newborn Action Plan. India Newborn Action Plan. Only 2 things you need to remember in India Newborn Action Plan. That is, we want a single digit. What do you mean by single digit? Obviously, it should be less than 10. We want single digit 2 things. What 2 things? Neonatal mortality rate should be less than 10 and the stillbirth rate should be less than 10 by year 2025. This is the India Newborn Action Plan. Coming over to next one, what is this logo image number B? Conspicuously, what I see over here is a kite, a child flying a kite. Remember, the kite program is a kite program, RKSK. What is RKSK beta? RKSK stands for Rashtriya Kishore Swasthya Karyagram. RKSK stands for Rashtriya Kishore Swasthya Karyagram. RKSK. MCQ, who is a Kishore? What age group is Kishore? 10 to 19 years. It includes both boys and girls. It includes both boys and girls. And what is the approach we use in RKSK? The approach we use in RKSK, it is called as Sathya approach. It is called as Sathya approach. RKSK is Sathya approach. India Newborn Action Plan we have already done. Next in line, what is this logo A and B? What is this logo A? This logo is where you see the mother is in safe hands. It is called as Prime Minister Pradhan Mantri Surakshit Safe Matritva Abhiyan, PMSMA. In this PMSMA, beta, this logo is for PMSMA. What is PMSMA? Prime Minister Surakshit Matritva Abhiyan. In this Surakshit Matritva Abhiyan, on 9th of every month, it's already written in the logo, on 9th of every month, there will be free ANC checkup. There is 9th of every month, 9th of every month, there is free ANC checkup. In the free ANC checkup, if you recall from your main lectures, that the green sticker is for normal females, the red sticker is for high risk pregnancies, the blue is for pregnancy-induced hypertension, and yellow is for any other comorbidity, renal disease, liver disease, thyroid disease, any other diabetes mellitus, any other comorbidity to the female. There is 9th of every month. It is for safeguarding the health of a pregnant female. Coming to this next logo, what is this logo number B over here? What is this logo, beta? This logo is for Matru Vandana Yojana. It's already written. It is Prime Minister Matru Vandana Yojana. And if you would have watched the main lectures again, it's an important update which came in 2023. So this Matru Vandana Yojana, Prime Minister Matru Vandana Yojana version 2.0 was launched, in which the government is now giving only 2 installments. Earlier it was 3 installments. Now there is only 2 installments. The first installment is for 3,000 rupees. The second installment is for 2,000 rupees. The first installment is to be given when the registration of pregnancy and 1 ANC is done. And the second installment is given when the child is born. Of course, after the child is born, the birth registration is done and the child has taken the first dose vaccine of BCG, DPT, OPV and hepatitis B. So first dose vaccine of these 4 essential vaccines is taken, then the female is eligible to get the next installment of 2,000 rupees. And also Government of India has started that if the second child is a girl child, if the second, this 5,000 rupees beta, 5,000 rupees INR, it is over and above the GSY scheme. GSY is also incentive based, na? So this 5,000 rupees is only for first born child, only for the first born child. And now Government of India has started 6,000 rupees is also given for the second child if the second child is a girl child. So if the second child is a girl child, only then the female is allowed to get another installment of 6,000 rupees. This is under the Prime Minister Matru Vandana Yojana. So these are 2 important yojanas that you have to remember, Matru Vandana and the Prime Minister Surakshit Matritva Abhiyan. Next in line, what is this logo? You see 6 people over here happily dancing. So which are the 6 people? 1, 2, 3, 4, 5 and 6. You see that this is a 6 by 6 by 6 program. Can you guess what is the name? Yes, you all are correct. This is the Anemia Mukt Bharat program. Anemia Mukt Bharat program, which is under the National Nutrition program, that is under the Poshan Abhiyan by Ministry of Women and Child Development and the Ministry of Health and Family Welfare. They want to have a solid body and a smart mind. That is one of the main interventions that we want to have, a solid body, smart mind. Alongside, we also want other interventions like deworming has to be there, prophylaxis of iron folic acid, there has to be intensified behavior change in terms of the same answer, solid body and smart mind. Then there has to be testing of anemia, provision of iron fortified foods, and non-nutritional cause of anemia also needs to be checked. This is Anemia Mukta Bharat 6 by 6 by 6 strategy. So make sure that you get all these questions right. It's pretty important. And with that, thank you so much for watching this image-based module. The right way to do the things is always the right way. So make sure you keep on doing your preparation and make sure that this video session beta image-based question is always an adjunct to the main videos or to the revision videos. So it's not that this image-based question video is it's a standalone video and you will learn everything from this video. No, it's always an additional feature, right? So happy learning and happy revising. All the very best.